If there's a young person in your life, you're going to want to hear this. More than 1.6 million middle and high school students used e-cigarettes in the U.S. last year. That's according to the CDC. That's actually down from over 2 million in 2023. But health officials say that is still too many and warn that most vaping devices sold in the U.S. are illegal products. That means you might not know what's actually in them. On Monday, the Department of Health and Human Services Office of the Surgeon General announced a guide to combat what it calls the ongoing youth vaping epidemic. Dr. Stephanie Herodopoulos is with us now. She's the acting chief of staff and senior advisor to the Surgeon General's office within the Department of Health and Human Services. Thank you so much, Doctor, for being here.
My pleasure. Thank you for giving me the opportunity to educate your viewers.
Okay, so first let's talk about the dangers of vaping, especially when you're talking about children. What are the risks?
Well, we delineated a lot of harms in here. First of all, the brain doesn't finish developing until about age 25. So any nicotine and heavy metals and chemicals that are introduced into the body can affect the full development of the frontal lobe. That could cause problems with memory, concentration, anxiety, and depression. So here, with this country having mental health issues, it is very important that we discuss not only to the heart health. There could be irreversible damage to the lungs with scarring. Not to mention, there have been some new onset seizures. It affects oral health. The list goes on and on. So really, the main issue as well is that their studies have shown that vapors have a 3 to 4 times increased risk when they're used to actually go to cigarettes. So we are trying to change that trend, and we are wanting to educate moms and dads and healthcare providers as well as caregivers with this new resource tool.
And it seems, a lot of these e-cigarette companies are trying to attract a younger demographic. So in what ways are they appealing specifically to children and teenagers with the actual products?
Well, you've mentioned that majority of these products are not even authorized by our FDA. There's only 39 by the FDA, and unfortunately 86% of the products sold at retail stores are from China, illicit, illegal, and not authorized by the FDA. Therefore, you have no idea what chemicals truly are in there. So what they do is they're changing their, flavors, fruit flavors to attract kids. They actually think it's candy. They don't maybe know that nicotine's in it. They've made a modern sleek, where parents wouldn't even know that they're doing it in their bedroom or in the back of the classroom. Sometimes they even have gamification involved, meaning it looks like a screen and they're playing a game, and each time they hit it, it's encouraging them to hit the vape more and more, or it makes it look like it's a camera. So really terrible that this has unfortunately come into our country and affecting our youth. And by the way, it's not even legal in China to sell vapes, but yet it's flooding through our country into our borders. But I will tell you that the Department of Justice, led by Attorney General Pam Bondi and Dr. McCary at the FDA, and our customs agents are doing all they can to make sure that these are seized. $86 million of vapes were seized just last week in Chicago. And our Secretary Kennedy was right there with our leaders leading that fight.
And so, vaping was touted as an alternative to smoking cigarettes. We were told, hey, it's less dangerous, it's less addicting. Is that true?
It's not less addicting. Actually, there's more nicotine. In each vape, it's equal to a pack of cigarettes, at least the amount of nicotine. And the nicotine percentage is 5%. For instance, in Europe, the maximum is only 2% nicotine. Is it less harmful? I think the verdict is out with public health officials on that one. Perhaps if an adult was trying to get off of combustible cigarettes, it might be a pathway for a short period of time for harm reduction, but definitely not for for never vapers, youth that wouldn't have smoked cigarettes, that are being introduced to this with predatory marketing that they actually don't know how harmful it is. And here we have a society saying that it's least harmful than cigarettes. So I'm here to say that that is not true for our youth, and this is why we came up with this youth vaping resource guide, which you can find on the Office of the Surgeon General. It talks about the harms. It also talks about if you are addicted and you want to get off of vape, there are a couple of resources. There is a 1-800 number, Quit Now. So if you know a loved one that wants to get off, and then also you could text to 88709, ditch vape, and you will get someone there helping you to get off of it. Most kids who are doing it don't want to do it. They want to get off. And so I find this document so important for the amplification of this message and talking about the harms and what it could do to you for your future and short-term and long-term risks.
Yeah, we have that information also on the screen that folks can write down as we're talking. So what advice can you give to parents and educators, even healthcare providers, to really prevent children and teens from vaping?
Well, I'm a family medicine physician, saw the whole lifespan of patients for 20 years, and I'm a mother of 3. And just a proud mom of 3 kids. And I went through middle school, high school with them. They're all grown adults now. We always had honest conversations at the dinner table, wherever it's convenient, and talk, or you're in the car driving. Hey, by the way, just do you know about how harmful vaping is? Bring it up to them. Don't be afraid to talk about it. And they listen. They might not respond, but they will listen to you and they will carry your message. So open, honest dialogue and conversation coming from a parent that they love so much. And for the healthcare providers, don't miss an opportunity at a visit to talk about the anticipatory guidance of the dangers of vapes, knowing that this is mostly what they're doing, as far as the largest preventable harm reduction tool that they could talk to them about. So if the dialogue is key. I just hope that people carry on this message and spread it to anyone that they know. It's not harmless. It could do great damage, and I want you to listen and talk to your children.
So important. Dr. Stephanie Herodopoulos, thank you so much for joining us today, and thank you for all of that information. So important to help protect our kids. We appreciate your time today.